Hey everybody, I'm here with Dr. Janjua at Janjua Facial Surgery. You can find him at janjuafacialsurgery.com. So we're here to talk about cosmetic surgery and some of the success he's having with his patients there. So doctor, thanks so much for joining us today. I really appreciate it.
Thank you very much for inviting me. It's an honor and a privilege.
Yeah, absolutely. I wanted to start off just by asking how long you've been working as a plastic surgeon.
Well, it seems like 120 years, but no, it's not. It's 22 years, so it's a long time, but still not too long.
Yeah, absolutely. Well, congratulations on the career with that. Was there anything in particular that really drew you towards working with those patients?
To be honest with you, actually, my passion when I started, I got into at Yale University in the program for head and neck surgery for patients, for mostly cancer patients. And I really wanted to do it, and I was very good at it during training. But what happened is that I started losing patients because unfortunately you can't save them all, and I would get emotionally attached. I'm kind of like I'm a very emotional kind of guy, so I can't be very cold. And it was very hard to kind of just live with that and say like, oh my God, doing it for the rest of my life. I really couldn't. So I was trying to find some happy surgery,
Sure.
for lack of a better word, which was also very challenging at the same time. So then I started thinking about, facial cosmetic surgery at the time, and I slowly moved myself into that field. And that's what I've been doing. So it's been making me very happy that I can make people happy and hopefully not lose them, like I unfortunately with head and neck cancer I did.
Right, definitely. Yeah, I can see that. I can see that being really rewarding, being able to work with those patients, and I'm sure they're, very excited to come see you and have those procedures done.
Absolutely, absolutely.
Yeah, and I was curious to find out from you, with the pandemic, the lockdowns and everything, did you guys notice a real increase in patients coming in once those were lifted?
I'll tell you, it was it was like a sigh of relief because we were shut down for 3 months in New Jersey and didn't know what to expect, if, people will come or not. So I still remember the day, June 8th, 2020, we were allowed to open. And since that day, it hasn't stopped.
No kidding.
It has been so busy and, couldn't figure out initially why, but it's been going on and it still is.
Mhm. Yeah, definitely. I think there was a lot of different factors with that that, we might not really seen coming, but, if you think about them, they kind of make sense in terms of, patients that, they're working from home so they can have a little bit more ability to have downtime and, with everybody doing Zoom meetings and everything, they're all kind of seeing themselves all the time a lot more. So a few of those things definitely contributed, I think.
Caleb, you're right. And it's very interesting because I've been thinking about it a lot along the way. And they call it the Zoom boom in plastic surgery. And that definitely was. But there was something else. And I finally figured it out. And I felt that a lot of people had kind of like a reset button when COVID happened. And especially people are a little older, not young people like you, but more like my age group. They started thinking like, wait a minute, COVID can really end everything. And now, wow. So, what, we got to do something with our lives and we got to do something that we enjoy. And a lot of people who were like on the fence about doing something, they're like, what am I waiting for?
Right.
I don't need to wait any longer.
Mhm.
And to be honest with you, I was one of those people myself because for the longest time, I wanted a nose job, but I didn't have time. And finally, I was like, wow, I can't keep waiting. I mean, every time I do a nose job on a patient, I'm feeling so jealous. So guess what? I went ahead and got mine done as well. So I think that was the biggest sense of like little fatalistic attitude, like, oh my God, existential crisis, like the world could end. Let's do something fun. So that I think really drove a lot of people. And
Yeah.
people started valuing their own happiness, whether it was through redecorating their house that a lot of people did or improving their appearance.
Yeah, absolutely. I think that's a great point. Yeah, I think a lot of those patients, took the time to do those things they wanted to do. Like you said, if they were on the fence at all, it was, why not just do it?
Yeah.
Mhm. And so what are some of the main procedures that you focus on there? Obviously, with the just being specifically a facial plastic surgeon.
Yeah, so I always tell the patients like from hair to hair, everything in there. Typical stuff which is very common is facelifts, very common. Rhinoplasties and nose jobs, very common. And eyelid surgeries to open the eyes, brow lifts, neck liposuction, lasers, Botox, fillers, everything. So pretty much everything that you can imagine in this area.
Hmm. Very cool. And is there any specific treatments or anything that you've been working on that you feel like you want to share some education about for the viewers?
Yes, actually, I was thinking about it, like, what is it that I would like to share? Because all these things are pretty common, So fortunately, I've been able to develop a little niche in two procedures, and it just kind of like fell in my lap. One is called alarplasty, and that is a medical term for narrowing the width of the nostrils or narrowing the flare of the nostrils.
Interesting.
And second is scar revision. So when I started working on my practice initially, I was developing all the normal stuff, but then I ran into a few patients where they had like scars, and that became a challenge. Like, how do I make it the best possible scar I can? And then I started getting better and better and better, and I started getting a lot of people, and it has been such a pleasure to help them with the scars. Very gratifying. Same thing happened with the nostrils, especially the patients who have like really wide nostrils. A lot of my African American patients have really wide nostrils, so they were always looking for a solution. And I have heard of so many times from those patients that, doc, till I met you before that, I couldn't have anyone help me with that. I would go to them and say, I want to change my nose, and they would always want to do a full nose job. I don't want a full nose job. I just want these nostrils to be smaller. And as one of my patients said, I remember, he was from Maryland, and he said, doc, all I want is, and I talk to people, they don't look at my nose, they look at my eyes. And he had really wide nostrils, so I really was feeling bad for him, and we fixed it, and he was so happy.
That's awesome to hear. Yeah, it's very interesting. Is that even something that's typically addressed with a typical rhinoplasty?
Not all the time. And actually, it's almost like an incidental thing that, typically surgeons will say like, oh, while I'm at it, let me just narrow it down a little. That used to be the way. And that's the way we were trained. And the procedure never got the respect that it needed. And, we would do it mostly on the Caucasian nose, the white nose that was narrow to begin with. So you didn't need to do much.
Right.
So we never got trained. Like, what would you do if you got somebody with a really big nostril? There was no training. It wasn't even in the books in detail. So I literally had to improvise, like, how can I manage it without making it like a really bad scar or serious issues? So that evolution was very interesting, very scary, but very rewarding at the end.
Yeah, it's definitely interesting. And what do you typically do with that procedure to make sure that you hide the scar and do all that?
So the first thing is to make sure the patient is a good candidate. Indeed, they're doing it for the right reason, and they're not asking for something unreasonable. Obviously, if their nostrils are not wide and they have to look pretty good, but they say, well, I want to make it narrower, then I have to be careful, because there's a downside. If you narrow the nostrils too much, you can't breathe.
Sure.
So that's the biggest thing. So you have to be careful. So the first thing is evaluation to make sure somebody can breathe pretty good and they are going to be okay with it. And second, that they are, mentally ready for it, because it's a big change in identity. Anytime you work on the face, because you see it all day. And also, nose is the center of the face. Any change there, it is noticed by patients, and it can be a little bit of overwhelming as well, unless you're well prepared. So once I feel that my patient is well prepared emotionally and physically, then I take a look, and what I do is I tell them like, okay, so let's see how much narrowing we can do. I take 2 Q-tips to gently push on it and put it closer. And then I show them this will be a small change, then a little more, a medium change, a little more, a large change. And then finally, really together, I'm like, that's a jumbo change. And that's somebody who's got really wide, and that's very uncommon. And then they can look at it, and we go back and forth and say, I like it. And let's, go to this level and we'll do it. Then explain to them the procedure. And then I tell them, please watch my videos. I have a YouTube channel. And if you can go watch my alarplasty videos, I have tons of videos there. That will really educate you, and you will get a lot of your own questions answered. And I made those videos also because sometimes it's very difficult to explain something in words. But if you have something that you're actually showing and is documented, it makes a lot more sense and makes it easier. So that's what I do. Once they've done that, then after that, we go ahead and discuss the details of like, when can we do it, and what is involved, what are the risks involved, and what can I expect in terms of the change and recovery. So I go over all those things.
Yeah, it's great to hear you've had, like you said, kind of a niche thing there where you're able to give those patients the results they're looking for, and it's not, they have to go try to explain that to someone and have a full rhinoplasty if they don't really need it.
That was a big thing. I honestly didn't even realize that that is an issue, and it was a big issue.
Hmm. Yeah, it's very interesting. What's the average, like surgical and recovery time with that procedure?
So it takes, I would say, like about an hour for the procedure.
Mhm.
And the beauty is that, I do it under local anesthesia, so you don't need to be put out.
Hmm.
And the recovery, I would say, is about a week. And I'm talking about like social recovery where, you're still a little swollen. There are some stitches that are slowly dissolving. And after a week, you're presentable, but you're not ready to go to a wedding or cocktail party.
Sure.
I would say like in a month's time, you're very presentable.
Hmm.
In terms of, physical recovery, there really is no downtime because you feel really normal, you feel really good, you can do whatever you want. We don't want patients to do too much physical activity like exercising and stuff, because if you're exercising, heart rate is going up, you're breathing heavy. And if you
Sure.
breathe heavy, like, that's what you're doing. You're pulling on the nostrils
Mhm.
and you have stitches in place. So we don't want to pop them open. So that's why I tell patients like, do your normal routine, but no heavy exercise for 2 weeks.
Interesting. And so with that procedure, are you actually removing part of the nostril
Oh,
or are you
yes.
tightening it?
Yes, absolutely. Think of it as like a pizza pie. So
Mm.
it's like a wedge of tissue you take and you remove it.
Mm.
And now you can pull the top edge inwards and downwards. So you're bringing it in.
Mm.
And when you bring it from both sides inwards, it becomes narrow.
Interesting. Yeah, that's great to hear. And then you mentioned the other thing that you do a lot of is the scar revision.
Yeah, the scar revision is big because, scars are annoying because they can be so disfiguring, especially on your face. And a lot of times patients are not even aware that surgical excision of a scar is a possibility. They always think that maybe lasers or something similar to that will do magic,
Mhm.
which it can in some cases, but a lot of times it cannot.
Mhm.
And it comes to the point where the scar literally has to be removed surgically. After that, you have to then treat it maybe with laser as a follow-up to get the best possible result. And that's typically what I offer to my patients.
Interesting. Yeah, and so when you remove the scar itself, are you able to, make really minimal other scars from that, and then it's able to be much more hidden than the initial one?
Exactly. And there are very well-defined principles to hide the scar that you can use. And you can basically hide it along a natural curve or line. And for example, one of the scars way back in the past I had was somebody had a bite of some fly and it became infected. It was like a big area of scar on the cheek. So it was a huge scar that I was able to excise and make the scar fall into the natural smile line.
Hmm.
So this way it looked like a smile line and not a scar, unless somebody would go and look closely. So that's one technique. Second is where if it's close to, let's say, like the hairline, you can pull it so where incision is within the hairline. Obviously, somebody like me can't hide it, but if somebody like you had a scar close to the hairline, we can pull it up and hide it there.
Hmm.
Also, there are areas where you can't. For example, it's right on the cheek here, and you have to just hide in a different way.
Hmm.
And in that, we use an illusion where instead of having a straight scar, which is very easily noticeable, anybody with like a straight cut anywhere, we break it into multiple small scars.
Hmm.
And this way, the eye doesn't notice it.
Hmm.
So the same scar is still there, but it is like a pattern of rectangle, round, triangle, straight, and it kind of blends in a way that the eye doesn't notice.
Hmm.
And that seems to work all this for the scars that you really can't do anything else about. And the technical term is geometric broken line closure.
Hmm. Yeah, it's very interesting. I don't think that's, something that I've heard of before.
Yeah, it's very technical detail, and not a lot of doctors use it all the time, and not all the plastic surgeons want to deal with scars. Everybody has their own specialty, and it especially is harder with darker skin.
Hmm.
And poor patients who have the darker skin like me, or even darker than me, sometimes they can't find anyone say like, listen, no, I can't do it, because typically somebody who has like really fine pale skin, very thin, like Northern Irish skin, they heal very well. And sometimes to the point where you really can't see the scar.
Yeah.
So that is like relatively easy to do, but the darker the skin, the thicker the skin, the harder it is. So that's my job. That's where I come in.
Yeah, absolutely. And do you find that most patients that have scars that they're looking to, improve or get rid of, are they typically from surgery, or what are they typically coming from?
They are typically coming after having failed, many different things. like laser, like microdermabrasion, like fillers. So they've tried all those things and they find like, you know what, I've done all this stuff, but it's still not looking good.
Mhm.
So then I tell them like, okay. And there've been times where they even went for surgery for a consultation and they were told like, you know, this is going to be just as bad, if not worse, don't do it. Because not everybody has, you know, developed that expertise to do it. So every now and then when I see someone, they're like, oh, you can do it? I'm like, yeah, I think I can. I can't make it disappear. I'm not a magician, but I think I can significantly improve it.
Hmm.
So that becomes very rewarding for them and for me.
Yeah, absolutely. And you find that many of them are like acne scars, or these patients that maybe had a procedure done, or what typically, causes the scar in the first place?
Very common with acne scars. And a lot of times it starts with just like some acne gone bad, or even just like a little pimple where, you know, they treat with injections, it became depressed, because that can happen sometimes. Now they went to get it cut out and then became a bigger scar. Then they did lasers, didn't get better, became even wider. So finally they're like, I've tried everything. Then they turn the filler. So that's very common case scenario, or a biopsy for a mole or something gone bad. And then you have accidents, pure accidents, where actually somebody was in a car accident or fell. And then now you're taking me the path, I'll tell you, getting more and more detail. Then recently I start running into these scars which are called tribal marks. So when I was a little kid, I used to watch it like on TV, where some of the African tribes, they would do tribal markings. And that's where the idea of tattooing and all that came. So I didn't realize it still happens. There are a lot of people, especially from Nigeria, I see, where when they're born, the local, you know, medical man or shaman or whoever it is gives them a cut, just cuts them. And that's kind of like their marking for the tribe. And it heals with like a wide scar that is very noticeable. And that becomes annoying when these, you know, kids have now become adults and everybody's asking like, oh, what happened? What happened? And especially the ones who have immigrated to US or Europe, where it's not a common thing. In Nigeria, nobody's going to ask them. Here they get asked and then they're embarrassed. So I've been getting a lot of those patients from not just US, but outside US who want to do it. And it's been becoming another subspecialty of the subspecialty.
Yeah. Yeah, no kidding. That's really interesting. And so those patients are able to really hide those scars and dramatically, reduce
Oh,
what
yeah,
they.
absolutely.
Okay. Yeah, that's great. I actually have a chickenpox scar that, doesn't bother me too much, but I wonder if that's something that you've ever seen as well.
A lot.
Yeah.
Exactly. Because what happens is that they're annoying scars because I mean, they're not big, but it's like, you know, like those things, you know, little divots you see on the moon surface.
Right.
It's just like that. And it's very easily noticeable. So some of the patients try to hide, but you can't even hide it with makeup because it's not a color issue, it's just a depression.
Right.
So
Yeah.
patients typically just try a filler to lift it up, didn't work, and then they try laser, didn't work, and then they come to me, what can you do? So then I have to cut it out first and then do the laser, and it looks really good.
Okay. Yeah, that makes sense. Does it typically make it worse when they try to do those treatments beforehand?
Not necessarily. Some have good success. I mean, in terms of the fillers, it might do. But the problem is that most do not, because the scars are, you know, hard tissue. So it's not like a little soft, plump pillow where you put a little some filler in there and it comes right up. It doesn't. The tendency of any filler is to just kind of like go around that area because the other tissue around it is healthy, soft, and pliable. So that makes it very challenging to get the filler right underneath it. And especially if you have more than one, it becomes very challenging.
Right, makes sense. Yeah, it's really interesting to see, how far the field of plastic surgery, continues to evolve, and just all of these kind of subspecialties and what, comes out of those.
Absolutely, absolutely. I mean, progress happens like, you know, little at a time, and something that's not even as much like, you know, a scientific breakthrough in like a technology, but just the thinking outside the box. We're like, you know, can we do it? Can I do it? I mean, and it's a big risk. And, you know, I had this one lovely lady, she's a nursing student, and she had a really, really bad scar that she had done everything. And she had so much acne, and unfortunately, she got bullied for it, even by some family members. So she was scarred for life, not just in the face, emotionally as well. And she used to hide all the time. So finally, when I was able to remove all those acne scars, I had only one choice. That was to just cut them all out. But then I was risking like a really long incision.
Right.
So I was sweating it. I'm like, what if it looks worse than what she had, all these little scars? So it was a leap of faith. So sometimes you have to think outside the box and then make that leap of faith. And then you can have like a really amazing results. And that's what happened. Obviously, you don't want to just jump and do that. You want to spend a lot of time thinking and planning. And that's what I do as well. I have most of my patients are out of state. So I have to do Zoom like you're doing right now, or FaceTime, WhatsApp, or video. And then what I do is I just draw on the paper while I'm talking to them, show them that this is what I'm going to be drawing. So, and what they do is they really like the idea that they have the input in it as well. And they say like, oh, I don't like this like this. And I tell them this is a team effort. I literally had a guy from Switzerland once, and he said, doctor, do you mind if I draw it for you before you cut it? So I was like shocked the first time. That was way in the beginning of my practice. I'm like, I've never heard that, but I always listen to patients. So I was like, yeah, please tell me. Go ahead. And it's funny because what he drew was excellent, almost better than what I would have thought. And then it hit me. I realized that, when I see somebody, I'm seeing them for maybe 15, 20 minutes for the first time. They've had a scar for years. So they've been practicing in their mind, and they've been going on internet and doing this and checking everything. So they might have a good idea. And lo and behold, it happens every time.
Okay.
Every time.
Yeah, I think that's a really interesting point. That's something that they see all the time and that they're very, aware of. And so they might have a little bit kind of more understanding of exactly what they're looking for. It's really interesting.
Yeah, absolutely. And even the one that I had, the big one that started, that honestly was my first probably video on YouTube for scars that took off. The guy told me, he said, doctor, why don't you just cut it closer to this line here? And I'm like, you know what, I'm cutting a lot. He said, so what? I don't mind, just cut it out. So I was like, okay, if he wants to, I'll go for it. So I went for it, and lo and behold, he was right. It ended up looking really good.
No kidding. And is that the reason why you decided to kind of start doing them that way as well?
I did, then I started getting a little bolder with the ideas like, okay, and it's like there's so many cases where the patient had nothing to lose. I was like, it's really hard to make it any worse, especially in that one Indian girl's case. I was like, oh, this poor thing, I gotta do whatever I can. And it was challenging, but so rewarding at the end, because now she literally feels comfortable enough to go out without a mask or without being self-conscious. And that's a big thing. And I never honestly realized, Caleb, that it can have such a big effect.
Yeah.
I never did. When I started interacting with patients, I was like, whoa, this has affected their whole life.
Right. Yeah, absolutely. It makes a huge difference if that's something that really bothers them for, such a long time, and then they finally get that removed. It's almost like a kind of a weight's lifted off their shoulders.
It is. It's just so rewarding. So it makes me happy.
Yeah. And so you mentioned, with looking for a good candidate for both of those procedures, you were looking for somebody that has, realistic expectations. Do you feel like, most patients really have pretty realistic expectations, or how much time do you have to really kind of spend managing those?
So I think they do. And I would say like 85% of the times, patients have very good expectations, maybe up to 90% of the times. 5 to 10% they might not. So I have to really explain to them, like, listen, it's not, it's not magic, it's still surgery. And once I explain enough, I think they realize it. And also, again, with the videos, they come prepared even before, because they've watched so much and the results before and afterward, they realize like, okay, this is what I can expect. And it's not going to be like, oh, there was no scar ever or perfect, but it's going to be much better. And I'm okay with much better as opposed to perfection.
Sure.
So yeah, so it's become very reasonable.
Yeah, that definitely makes sense. And, obviously we're talking about really specific kind of niche procedures here, but what do you feel like is kind of some advice you could give to patients that, if they're looking for one of those more traditional procedures like a facelift or rhinoplasty or something, and they're really just thinking about kind of the price of it and not so much kind of the qualifications of the doctor?
Oh boy, yeah. That's very important actually to bring up. I'm glad you did. I would say, and this is advice I would give to like a family member. I would say like, do a lot of research, talk to friends, go online. You can find a lot of stuff online these days. I mean, so if you're not reading the Google reviews or something else to really find and get to know that doctor, you're not doing a good job. And make literally like a project where you take notes on every doctor and stuff, and then you narrow it down after your initial research to like 2 or 3 surgeons that you feel are like really competent, qualified based on your research. Then see at least 2 of them, and maybe even better 3. And then after that, once you've taken the notes and you've done the consultations, then go with your gut. Don't worry about the money. Don't make that. That'd be a big mistake.
Mhm.
And I sometimes tell patients like, listen, if you can't afford it and you're trying to, shop around,
Mhm.
just don't do the procedure.
Mhm.
Don't. I mean, a bad procedure is not worth it.
Mhm.
That maybe you save money, but now you look worse, or you had a really bad problem. It's
Right.
not worth it. Yeah.
Yeah, definitely. Yeah, I think it can be difficult, if a patient gets really excited about one of those procedures and knows what it can do for them, but maybe can't, quite afford it yet. It can be difficult to hold off on it, but it's definitely worth waiting until you can really, get the type of surgeon that you're going to need for that.
Absolutely. I mean, I've had teenage girls who come with parents sometimes, and the situation is such that unfortunately the family really can't afford to do it. So I tell them, the young teenage girl, like, hey, listen, you're gonna have a future, you're gonna have jobs, you're gonna make money one day. There's no rush.
Mhm.
If you can do it right now, guess what? You will be able to start
Mhm.
saving towards that goal. And that makes complete sense to them. And they're like, okay, as much as I want it right now, my parents can't afford it. I'll do it myself. And the same I tell to other adults as well. I'm like, listen, don't put yourself in a bind.
Mhm.
Don't. You don't need to break your bank to do something. It's not that critical.
Mhm.
Save it and then spend it.
Mm, yeah, that's good advice. And what would be the best way for patients to get in contact with you if they're, specifically having some of those issues and they maybe could benefit from some of those procedures we were talking about?
Sure. So the best way is to go to my website, janjuafacialsurgery.com. Everything is there. And if any patients with the wide nostrils are concerned, then I have a whole separate website for them. It's titled alarplasty.com.
Mhm. Okay, perfect. Yeah, well, those were the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're, maybe considering one of those procedures?
Yes, I would tell them all, listen, you have to first realize you're all beautiful. We're all beautiful as human beings. And that's very important to have that message. So do it for the right reasons. If something bugs you, just because it bugs you, that's fine. You can address it. But
Mhm.
always have the self-esteem, the confidence that you should before you go into it. And also make sure that you're not doing it because you're depressed or anxious or something else going on in life. Otherwise, it's not going to make you happy.
Mhm.
Patients who already are happy to begin with, they have fantastic results. They're a lot happier. But if you have a lot of unhappiness going on and you do these procedures, it's not going to end well.
Right.
So get solid inside first and then proceed to do whatever you want to do.
Awesome. Yeah, I think that's great advice.
Thank you.
Yeah, of course. Well, thanks so much for taking the time to talk with us today and share the education. That was great to hear.
Same here, Caleb. Thank you for giving me the opportunity. You have a fantastic day.
Awesome. You as well. Thanks so much.
Thank you.